more interesting video. Let's go. Hi Rajia. So what kind of patient that actually need to do endoscopy?
There's two types of endoscopy, the upper part and the lower endoscopy. So normally in upper part we do gastroscopy, or in short term is OGDS. The common reason to do gastroscopy is that when you have vomiting or heartburn, difficulty in swallowing, then doctor will advise you to do gastroscopy.
I see.
For the lower part, normally symptoms like constipation, bleeding, rectal bleeding, unspecific abdominal pain, then that's the common reason why doctor asks you to do the colonoscopy.
I see. It means that normally if patient has this kind of symptoms, they will first have to consult the doctor. If the doctor find it's necessary to do so, then we'll advise them to go for endoscopy, right?
Yes.
I see. So prior to the procedure, is there any preparation needed to be done?
Yes. For gastroscopy, patient required to fast at least 6 hours.
I see.
Yes. And for colonoscopy, generally 1 day before, patient need to take liquid diet, and doctor will prescribe medication, we call it bowel pack, to clear the bowel.
I see.
Like the day before and on that day of procedure.
I see. So this is the endoscopy unit where the endoscopy takes place. Let me show you what endoscopy is. So endoscopy is actually a procedure using an endoscope to check the inside of the body. In practice, endoscopy can actually be starting as a diagnostic endoscopy, which is to examine and to diagnose, and become a therapeutic endoscope, which is for treatment and depending on the findings. Endoscope is a thin tube-like flexible instrument with a light and a lens for viewing purposes. Upon the arrival of the patient, they will need to report themselves to the endoscope reception counter, whereby the staff will direct the patient to keep their valuable items in a locker and to change into procedure gown. There's a pantry right beside the locker available for patients' use. Patient will be asked to lie down on the bed for pre-procedure preparation, such as checking on the BP, pulse and oxygen level, body temperature, and to take medical history. Before the patient undergo the scoop procedure, Branula is inserted. This is for sedation drug injection purposes during the procedure. Normal saline is used to make sure the Branula is inserted in the right place. Before starting the procedure, the nurse will read out the type of procedure, patient's name, hospital number, and doctor's name to ensure the right procedure is carried out to the correct patient. The doctor is now injecting sedation drug, followed by normal saline to flush the drug in. In this scene, doctor is performing OGDS, which is gastroscopy procedure, right after patient was sedated. The scope is inserted through patient's mouth and doctor is able to view the inside through the monitor screen. This is biopsy forceps. It is inserted through the scope to take some tissue sample from patient's stomach to check if there's any bacteria such as Helicobacter pylori. In this scene, doctor is performing colonoscopy right after patient was sedated. The scope is inserted through patient's anus to allow doctor to check and detect for any changes or abnormalities in the entire large intestine and rectum. After the procedure is done, patient will rest in the recovery area. The nurse will check vital signs, BP and pulse once every 15 minutes for at least an hour until the patient is fully conscious. Once the patient is fully conscious, he or she will then be assisted to get up from the bed and will be seated at the post-waiting area while waiting for other investigation if there's any, arrival for family members, or waiting for post-consultation. After each usage, the scope is removed from the endoscopy machine for cleaning purposes. The nurse is using water and detergent to wash the scope as the first step. Once completely cleansed using detergent, the nurse will dry the scope using a cloth and then place into the automatic endoscope washer. Once completed, the scope will be placed into the storage tray and kept in a dry cabinet. The nurse is now attaching the scope to a tubing and connector connected to the cabinet to allow flow of air into the inside of the scope for drying purposes. The nurse will first scan to open the cabinet and place the scope in. The machine will automatically identify the scope when the nurse scans for the second time, and the timer will start running. With this cabinet, it can dry, protect, store endoscopes, and maintain their microbiological quality for 7 days. Each endoscope is stored in an individual tray with a lid in order to guarantee protection against knocks and contamination. For the next usage, the scope will be placed in the transport box and bring to the procedure room. So after the procedure, the patient will be rested at the daycare to make sure that they are back to conscious and able to walk. Then they will be offered food and will be consulting the doctor later on to understand what has been done. So some patients, they might have a little bit symptoms like bloated and also may have a little bit bleeding if polyps is being removed. So all this will be explained by the doctors. So that's the end for today's vlog. I hope that you have a better understanding now on endoscopy and is more ready for the procedure if needed. So do share this video out to your friends and family and check out on our previous episode as well. I'll see you on my next video. Bye!